And I want to get into that, Dr. Llaguna, because there are improvements in the way we treat cancers, like stomach cancer. So what are they that have been able to decrease that number, as we were discussing earlier?
Of the incidence?
Yes.
So one, a big breakthrough was really the discovery of H. pylori as being one of the primary causes of increased acidity, which can lead to ulcers. And the story is interesting. I believe it was in the 80s, an Australian physician kept on finding this bacteria, which eventually was identified to be H. pylori, in specimens of patients who had surgery for ulcers. His theory was that this bacteria that he commonly found within the specimen was probably the etiology of the ulcer.
Right.
But he couldn't figure out a way to study it, so he created a broth and he actually ingested the broth himself. And after a period of time, he himself developed symptoms which were related to an ulcer. And he actually won the Nobel Prize for this discovery. Yeah. So once we discovered this, then we figured out a way. I mean, when we talk about cancer prevention, we need to know what the cause of it is, right? So, when we look at cancers and carcinogens, environmental stressors and that can stress our body to an extent that can provoke the development of a cancer. Infections are one of them, and we talked about like HPV with cervical cancer or oral cancers, H. pylori with gastric cancers. Right. We tend to do well with these because we find the source and we can treat it with in this case, an antibiotic or an antiviral.